Hello, Happy New Year. Today we'll be discussing cyst period. Someone actually requested that we should talk about cyst period. Cyst period medically is known as amenorrhea. And what is amenorrhea? Amenorrhea is defined as absence of menses. It is the same as absence of menses. For a young lady that is up to reproductive age and has not seen her period, that is amenorrhea. For someone that has had a regular period and stopped seeing her period, is also known as amenorrhea. So amenorrhea is divided into two. We have primary amenorrhea and secondary amenorrhea. When do we say that someone has primary amenorrhea? When a young lady is up to 16 years and has not seen her period, that is known as primary amenorrhea. But when someone that has seen her period before and her period has been regular suddenly stops seeing her period consecutively for 3 months, that is known as secondary amenorrhea. So how does period come about? Let's go to that so that it will be understood. How does menses come about? When a young lady is growing, at that time is supposed to see her period, the brain recognizes that this woman is already in reproductive age and can carry a pregnancy. So what does the brain do? The hypothalamus in the brain signals the pituitary gland also in the brain to release what we call the hormone known as follicle stimulating hormone. This follicle stimulating hormones acts on the ovaries. The ovaries will start developing eggs. So as it's developing these eggs to release it for fertilization to happen, the hypothalamus in the brain signals the pituitary gland to release the hormone known as follicle stimulating hormone. It also releases another hormone known as luteinizing hormone that will help with what we call luteinizing hormone surge. We'll come to that. So the follicle stimulating hormone acts on the person's ovary. The ovary, it begins to form follicles, what we call follicles. They are tiny eggs. That's what actually form human beings. So when they act on those ovaries, follicles are released. Those ovaries also releases another hormone known as estrogen and progesterone. The work of the estrogen is to grow the womb, the endometrium. It grows it, makes it breathe, also grows the breast. Then the progesterone acts on the endometrial lining, makes it as very good for implantation. That is for the baby, for the fertilized egg, if the egg is fertilized, to implant. So as those hormones are released, the ovaries are growing, the eggs are growing, the ovaries are also releasing their hormones. The next thing is that the womb is prepared for fertilization. At the time of ovulation, which supposedly is the mid-cycle, what happens is that the brain also releases the second hormone known as luteinizing hormone. So at that point, there is luteinizing hormone surge. That causes the egg that has grown well to rupture, and that is ovulation. So when this ovulation occurs, the progesterone level grows higher, preparing for fertilization. If there is no sperm to fertilize that egg, there will be no pregnancy. But if there is a sperm to fertilize that egg, pregnancy occurs, and the fertilized egg implants in the womb, that is the endometrium. But if there is no fertilization that happened, the level of progesterone, the level of estrogen declines, and the egg is absorbed. Then the endometrium now sheds. That endometrium that has been prepared for fertilization sheds as menses. So when someone has any form of amenorrhea, either primary or secondary, it means there is something, the hormones are not working the way they should be. And what are the commonest causes of cyst period? There are three commonest causes of cyst period. One is pregnancy. When a woman is pregnant, automatically period will not occur. Remember, period is the shedding of the endometrium. So when somebody is in that endometrium, that is a fertilized egg, becoming a baby is in that endometrium, in that womb, it will not shed anymore, and so the person will not see her period. If you are watching me and you have had cyst period, or you just missed your period, please, the first thing to do is pregnancy test, because that's the commonest cause of cyst period. The second commonest cause of cyst period is breastfeeding. Someone that is breastfeeding, the brain senses it that this woman is breastfeeding, and so it's a natural way the body makes it possible for that baby born to be taken care of before another pregnancy occurs. So somehow there is suppression of these hormones that helps the egg to grow. So the follicle stimulating hormone will be suppressed. The brain automatically does this. There's high level of prolactin. The high level of prolactin is what makes the breast milk to flow and you'll be able to breastfeed your baby. Whenever you stop breastfeeding your baby, the body automatically goes back, prolactin level decreases, the pituitary gland takes over, and another menses starts. Then the third commonest thing that causes cis period is menopause. Either premature menopause or full-time menopause. When a woman has reached menopause, it means that the pituitary, the brain, the ovaries have retired, and so the person will not see her period again. Apart from this, any other form of cis period can signify a problem in the person's body, either the hormone of the person or lifestyle of the person or health condition of the person. So any of these can cause cis period, apart from the commonest physiological causes that I mentioned. So if you are joining me for the first time, my name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Ada Zion. So please subscribe to my YouTube page, follow me on Facebook, Instagram, and TikTok with the same name, OBGYN Talks with Dr. Ada Zion. Share this video right now, it will benefit somebody. Let's go on. What are other causes of cis period? The causes of cis period include someone on birth control. If someone is taking oral contraceptive pills and do not take the placebo part of the oral contraceptive pills, the person may present with cis period, or the person's period can just cease. So the oral contraceptive pill is designed in a way that you take the continuously the hormonal pills for 21 days and take a placebo for 7 days. So when someone is on oral contraceptive pills and do not take the placebo, there will be no space. So the body is constantly suppressed and the person may not see her period. The endometrium will not shed. Other persons on intrauterine contraceptive devices, mostly the intrauterine system, that is the one that is progesterone laden, the person may not see her period. It may be cis period. Others include someone on implants may present with cis period, So the person may present with cis period. So birth control is one of the causes of cis period. Another cause of cis period, which could be pathological, is polycystic ovarian syndrome. In polycystic ovarian disease, a female child or a female has high level of male hormones, hyperandrogenism, and this will suppress every form of the system, the way I listed it before, how menses come about. So there is increased male hormone in that woman, and so the person may present with cis period, or the period will take longer before it comes. Sometimes it does not come at all for a year, except the person seeks medical attention. So that's another cause of cis period. Then another common cause of cis period is premature ovarian failure. When there is premature ovarian failure, it means that the ovaries, everything about the ovaries and reproductive system stops working before the age of 40 years. That's why we call it premature ovarian failure. So such person can present with cis period and requires medical attention. Another cause of cis period is any problem with the genital tract. If there is, when the brain works, the hypothalamus, the pituitary releases their hormones and it works in the ovaries. When it works in the ovaries works on the endometrium, that is the uterus, the womb, and the womb sheds through the vagina. So if there is any problem with the genital tract, for example, if there's something we call imperfect hymen is on the person. Imperfect hymen means that, as a virgin, what causes the late term will know is someone is a virgin, but that is about the hymen. So when the hymen is closed totally, there is no space for menstrual to come out. The person does not know a man, has not had intercourse for the first time, and the hymen is totally closed. The menses will be occurring, but it's accumulating in the vagina. So the person, after some time, will present with severe waist pain. So imperfect hymen can be a cause of cis period. Other forms include uterine synechia, when there is adhesion in the endometrium. Maybe the person has had some endometritis before, or there is infection of the endometrium, or the person has had what we call synechia, adhesions. When there's adhesions in the endometrium, maybe from infection of the endometrium, that is the womb, or the person has had overzealous curettage, he has done some termination of pregnancy, and the person that did it does not know how to do and overzealously did it and removed the endometrial lining. So it will heal with fibrosis, and so the ovaries will be working, but menses will not occur. These are some of the problems with the reproductive tract that can cause cyst period. Now, the next thing that can cause cyst period is excessive exercise. When you excessively exercise your body, the brain senses it that there is a problem, and so the way to conserve fertility and reproduction is to stop menses. So over exercise can cause cyst period. Then stress. When you're seriously stressed, over stress can cause cyst period. There are some medications, especially for mental health, antidepressants. Some antidepressants can cause cyst period. Then some eating disorders. There's one we call anorexia nervosa. Some people that practice that, after eating they will vomit because they want to lose weight. It can cause cyst period. Now, some nutritional deficiencies can cause cyst period. So when the treatment for cyst period depends on what is found. It is not something to visit a chemist. It's not something to visit a pattern medicine dealer. You have to go to the hospital and be evaluated by a doctor. And when the doctor evaluates you, they will find out the cause of that cyst period. And if the cause is found, treatment is easy, and the person can resume their period and get pregnant or live her life the way she wants. So these are the causes of cyst period. I hope that with this point I have answered the question of I should discuss cyst period. If there's any other question, drop it on the comment section. I will attend to them. My name is Dr. Kiruka Bridget at OBGYN Talks with Dr. Adazayon. I discuss everything about women's health, children's health, and sometimes men's health. Keep a date with me next week as we're discussing another beautiful topic. Thank you. Subscribe to my page right now if you have not done so. Share this video. Subscribe to my page on YouTube. Follow my page on Facebook, Instagram, and TikTok. I also offer online consultation. Hit my DM. Let's discuss about that health issue. See you next time.